Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. We're going to be talking about cancer research and abortion care in just a minute, but before we do, down below in the YouTube description box, you'll find the link to the Healthcare Advocacy newsletter, which is the text for this video. You can go to that link, subscribe for free. All of the background material and news stories and studies and actions that I mentioned, everything is in there. Okay, let's get started. Today is August 13th, 2024, and the Biden administration, the executive branch, is announcing today $150 million in new funding through the Advanced Research Projects Agency for Health, ARPA-H, to speed the development of technologies aimed at improving tumor removal surgeries for cancer patients. Man, that would be great. The awards will be announced, or actually by the time I'm speaking, they should have been announced momentarily, at an event in New Orleans that is spotlighting the administration's Reignited Cancer Moonshot Initiative, which aims to cut the death rate from cancer in the United States in half by 2047. The funding will go to researchers from 8 teams across the country participating in the agency's Precision Surgical Intervention Program. Let's talk about health insurance and immigration policy, because the two of them combine in a not too nice way. There are 15 Republican state attorneys general are now suing the United States government, the executive branch, the Biden administration, over its announced plan to extend the Affordable Care Act coverage to children of undocumented immigrants under the Deferred Action for Childhood Arrivals program. I'm going to read you the list of states. And you know what? I'll put the list into the YouTube description box because there's an action related to it. The states are Kansas, North Dakota, Alabama, Idaho, Indiana, Iowa, Missouri, Montana, Nebraska, New Hampshire, Ohio, South Carolina, South Dakota, Tennessee, and the Commonwealth of Virginia. Here's the action. Ready? If you live in any of those states that are suing the U.S. government for opening the Affordable Care Act to those children brought here illegally as minors, you can write or call your state's attorney general, and I have a link which I will put into the YouTube description box. It's under the resources section. You just click there, put in your address, go over to state officers, and you can find your attorney general. Anyway, here's what I think you ought to tell them, but you can tell them whatever you want. I'm a resident of, pick your state, and I want you to know that I am ashamed of your cruel lawsuit against the U.S. government for opening up the Affordable Care Act insurance to DACA recipients. You lack concern for others. Your lack of concern for others is matched only by your disregard for public health. Rest assured, your actions will be remembered at the next election. And then do it. Okay. Next one, abortion news. Excuse me. 2 women have filed complaints with the federal government alleging that Texas hospitals denied them abortion care necessary to treat their ectopic pregnancies. The complaints were filed August 6th, so just a few days ago, by Kelsey Norris de la Cruz and Kylie Thurman against Texas Health Arlington Memorial Hospital and Round Rock-based Ascension Seton Williamson Hospital, 2 hospitals respectively. Both women are represented by the Center for Reproductive Rights. Both say that the hospitals denied them appropriate stabilizing medical care, which hospitals that accept federal Medicare funding are required to do under the Emergency Medical Treatment and Labor Act, also known as EMTALA. Now, an ectopic pregnancy happens when a fertilized egg implants outside the pregnant person's uterus. It can be fatal to them, and it cannot result in birth. Both women had ectopic pregnancies that implanted in their fallopian tubes, which connect the ovaries to the uterus. The women say they were initially sent home without receiving appropriate care from the hospitals, which in this case should have been terminate the pregnancy. That is what you do. Okay. Doctors and hospitals are afraid to provide appropriate medical care because they can be sent to jail or sued. Now, in theory, Texas law, which bans almost all abortions, allows termination for patients with ectopic pregnancies, but the physicians still have to prove in court that the abortion they provided is protected by law. As a result, doctors in that state have said openly that offering abortion still carries immense legal risks, even for ectopic pregnancies. And they don't want to bother, they just don't want to do it. Got to end this nightmare. Let's remind our elected officials that in over half the states in our country, women are not full citizens, and that passing the Women's Health Protection Act is at least a step forward for them. I didn't put it in the newsletter, but I'll tell you, the Women's Health Protection Act restores the rights of Roe v. Wade nationwide. Okay, so let's call our senators or our members of Congress, call them both, or write to them. The link to get that information for them is in the YouTube description box. You want them to pass Senate Bill 701 or H.R. 12, which is the Women's Health Protection Act. Or use my favorite way, ResistBot on your cell phone. Just send this text message to 50409, sign SIGN space PZGSMU. Sign space PZGSMU to 50409. And here's the message. I'm your constituent, and I want you to know about 2 women in Texas who had ectopic pregnancies and were denied abortions at their local hospitals. Both lost a fallopian tube. Did you hear that? They lost it because the doctors and hospitals were afraid to provide emergency abortions that these women so desperately needed. You can fix this nightmare for other women, and I want you to do that. I want you to do everything in your power to get the Women's Health Protection Act, Senate Bill 701 or H.R. 12, to a vote. Think of discharge petitions. Think of attaching it to must-pass bills. Whatever. Women are not second-class citizens, yet 21 states treat them that way. I'm counting on you to have the courage and stand up for all the women in this country. At the bottom of the email you'll be sending is a hyperlink to the news story so their legislative analysts can go and read it. Okay, look, this is what I've got for you today. Down below, you can like, share, and subscribe. You can send me comments to healthcareadvocacy1, all one word, @gmail.com, or put them in the YouTube comment box, and I'll respond to you. Thanks so much. Have a good day.